Welcome to this M3 Impact Moment. We're really excited today to have Greg Seager with us. Greg's from Camden, Texas. Is that right?
Well, close to Kenton.
Kenton, Texas.
Little town called Grand Saline, Texas is where we're
Yeah.
located.
We're so glad you're here, Greg. And you are with an organization called Christian Health Service Corps.
That's correct.
And you and your wife, Candy, you founded that?
That's correct. We founded the organization not all that long ago, in January of 2010, but the Lord has been faithful to really grow that organization. We are actually the only mission organization that was specifically created to prepare, send, and support healthcare professionals as long-term missionaries. So my wife and I both started in short-term missions.
Because you're a nurse.
Yeah, my wife and I are both nurses by training. I'm still trying to learn how to make the transition to being sitting in the office all the time and not being out taking care of patients.
Dirty. That's right. Yeah.
But it's been a good transition, and the Lord is faithful, and we have gone from no missionaries to having full-time staff in 14 countries, about 45 families all together, mostly physicians, but we have other health professionals as well, nurses, we have a physical therapist, dentist, so kind of a wide range of folks who serve full-time at various mission hospitals around the world. Yeah.
Now this is amazing because unless you're in this world, you may not know what a sending agency is. And so, for some of our viewers, tell us what a sending agency is.
Well, sending agency partners with churches partners with sending churches to really help people, prepare people, and support them when they're on the field. Especially, sending a doctor looks a lot different than sending a pastor to plant a church or teach in a Bible college. And the challenges especially that our folks endure at mission hospitals is a lot different. They work in environments that are hard. They serve in areas where malaria and malnutrition are stalking children like a lion looking for its next meal, and making sure that we're supporting them in a way
because when you're dealing with death day in, that's what you're alluding to. When you're dealing with death day in and day out, it takes a toll.
It does, and they're there to be ministers of the gospel, to honor and glorify Christ with the skills, knowledge, and ability God has given them. Mm-hmm. Supporting them in that process is a lot of what we do. We have in Grand Saline. It's a little retreat center as our headquarters, and we use that to transition our staff on and off the field. Use it for a place of retreat and counseling and just making sure that our families are healthy, emotionally, spiritually, physically.
Yeah. And you will not only do it here, though, Greg, you will go to the missionaries, will you not?
Correct, yeah. We try to do site visits for as many folks as we can. Mm-hmm. Obviously, we can't get to all of our locations every year, but we do our best to go out. Our director of training is down at Loma de Luz with our staff down there right now in Honduras. And we'll probably be out to 3 or 4 locations in Africa this year.
Yeah, that's amazing. I can tell you, spending as much time as I do in mission hospitals, it's draining, it's depleting, and especially, it's not like somebody can give you a break. It's not like you can go for a vacation very often. You can't leave. And the same problems that we as physicians here, we as pastors here, we as people here in the States have, seems to be kind of amplified over there. And, I just appreciate you not only sending people, but, doing the pastoral support that's so important. And then when they come back for furlough or vacation or for breaks, you will debrief them and you'll counsel them as well. So I appreciate that. Now, you're also an author. You brought some of your books today.
Yes,
tell us about that.
Well, the ministry came out of really a passion that we've had for some time to really study missions from the other side, from the receiver side, and to look really specifically at what are the best practices involved in healthcare missions. Correct. So in 2012, we published this book called When Healthcare Hurts, an evidence-based guide for best practices in global health initiatives. Yeah. And although it's geared towards primarily the short-term mission organizations and churches and even universities that are sending out folks, it has application kind of broadly across both short and long-term. This is central to who we are as a ministry, the idea that when we engage in missions, that we really support and promote human dignity, and we support and promote patient safety in the construct of healthcare delivery.
True.
and there has been some challenges with teams setting up in churches and schools, and it's hard to maintain patient safety in that.
Yeah.
So one of the things that I would say 95% of those problems could be eliminated if we connected those teams to functional mission hospitals and health programs.
Yeah, we talked about this at lunch the other day, didn't we?
Yeah.
I really am a believer. Let me just dovetail on that. One time, Greg, I was at a mission hospital. I'd been there for several months, and I found out that 2 or 3 miles away there was a short-term mission team doing a clinic. They had no idea we were 3 miles away, and wouldn't it have been great if we could have partnered together? Because they could have brought their resources and expertise, and you know what, we could have follow-up, we could provide the exam rooms. Talk about that.
Oh, that's just, I had a similar experience last time I was visiting. We have a pretty good-sized staff now at Loma de Luz Hospital along the coast of Honduras, and I was leaving there, and I got 3 miles down the road, and there was a big team setting up, and I stopped, and I said, introduced myself, and I said, hey, did you have any communication with the folks at the hospital up the road? And the question I got was, what hospital? Mm-hmm. And you know what? There are hundreds, if not thousands, of mission hospitals they're fighting for survival, and it's mainly because they've been abandoned. They've been largely abandoned by the denominations that originally founded them, and they're trying to provide functional healthcare services in places where, the average payer base is $2, makes $2 a day, and they desperately need our support as a global church, and the idea of being able to connect short-term volunteers and short-term teams with those, even those teams that don't have, some churches say, well, we have 3 doctors and the rest of our folks are not really medical. But, the value of that team in a mission hospital compound is
it's
invaluable.
It's amazing.
Yeah.
I tell people, most of y'all know that I'm a general vascular surgeon. I spend a lot of time overseas at remote areas working at mission hospitals, but I also am a pastor here. And in recruiting people for the mission field here at this church, I tell people that one of the most valuable people that we need on the mission field are diesel mechanics. And they laugh because you don't ever think of needing a diesel mechanic to keep these vehicles running. And IT and diesel mechanic and carpentry and plumbers, electricians, boy, they're invaluable in the mission field.
Absolutely.
So let me ask you a couple questions.
Sure.
So if you're a young person and you're thinking about medical missions, do you have any, or maybe you're already a practitioner now, do you have any training that's available that you guys do?
Yeah. One of the things that we felt really important, or that was really important when we started this ministry, was that we develop a functional training department where we look at things like what are the World Health Organization standards for practice in developing communities, whether that be in the OR or in the community. What are things like integrated management of childhood illness? Those kind of things that most practitioners here never hear about, they never really see and
You're
study.
talking about things like malnutrition.
How to deal with malnutrition, how to deal with
HIV in kids.
TB in kids,
malaria.
all these things, malaria, dengue, all these things that we don't see a lot of here. So we felt that those are important. And of course, the missional preparation is important, and that looks a little different depending on where they're going.
Yeah.
But we offer a 2-week course that is called our Village Healthcare Intensive, and that covers kind of the basics of those standards. And then the second week, we go through like even a suturing workshop for nurses that don't have a lot of experience in that area, and then all the way up to basics of tropical medicine. And we have a new director of training who came on last year. Her name is Dr. Laura Smelter. She was with Egbe Hospital in Nigeria for a number of years, and she's been all over the world with Samaritan's Purse. So she's just been an amazing resource, and she leads that course. We also have another course that's the International Standards for Disaster and Refugee Response. We thought, based on the growing refugee problem through the world, that was an important course to offer, and that's actually the SPHERE project. And there's 3 SPHERE International Standards courses being offered here in the United States next year that I have found. One is at Harvard, and 2 are in Little Grand Saline, Texas, at our headquarters. But we feel that those
You're in good company.
Yes, I'm not sure they compare, but we are honored to be able to offer that that course. And then we have another one is one we even offer we even make our orientees as long-term missionaries do, and that's called Community Health Evangelism. And that's important because it really gets to the idea of how does this thing called supporting human dignity work. We talk about that in missions, but in reality we need to begin to see past the poverty, and that course really helps us learn how to do that.
Yeah, it's so good.
And help people and begin to see people as stewards of resources, not victims of circumstance.
Yeah.
And that is so vitally important in what we do, so that they can begin to respond to their own health needs. And that's
empowering.
That's what we need to do, is begin to empower people and not remove their dignity by providing services they can do for themselves.
So good. Well, so if people want to know about your organization, what's your website?
healthservicecorps.org.
Okay.
And service is not plural, it's just Health Service Corps. Just like the National Health Service Corps, we're the Christian Health Service Corps.
Yeah, that's so good.
So, yeah.
Well, you know, I'm excited too, because we really have not talked about this and not even promoted this yet, but we're going to have some pre-conference seminars occurring from 1 to 4 o'clock at the Doubletree Hotel right next to Lakewood Church. And this is kind of a pre-conference seminar that we're putting on, and you and Laura, I think, are going to take one of those. Well, actually, you're not going to be here. You're going to be in Taiwan, or Thailand.
Yes.
But Laura's going to do one of those. Tell us about that.
Well, I think I think Dr. Laura and probably my wife will come down to help talk a little bit about what is best practices in healthcare missions, and explore some of these training opportunities, and really kind of help people at least get a preview of some of these important areas of missions and ministry. How does that and see how that plays out on the mission field, but ultimately give them maybe a little bit of what we teach in those courses that are a week or 2 weeks long.
Yeah, we're so glad you guys are going to be involved, and thanks for your time today. And listen, we would love to see you at the M3 Missions next year. M3missions.com, you can find out all the information. It's February the 17th and 18th, 2017. Greg won't be there, but Dr. Laura will be there, Candy will be there, and more importantly, Christian Health Service Corps will be there. So thank you very much, Greg, for your time.
Thank you, Dr. Paul. I appreciate it.